Hi guys, it's me from the future. And unfortunately, I'm unable to be here with you all live, but thankfully, Professor has allowed me to record this, and hopefully everything runs smoothly. So, without further ado, the title of my project is Evaluating the Cochran-Mantel-Hansel Test versus Logistic Regression in Detecting Treatment Effects in Clinical Trials. Okay, so the data I'll be using will be from work. It's clinical data, and specifically from a class 3 medical device. So think of it as something similar to like a pacemaker device that's implantable. And a quick background on classes. Class 1 medical devices are low risk. So think of like bandages, dental floss, handheld surgical instruments. Class 2, moderate risk, powered wheelchairs, condoms, and pregnancy tests. And class 3, high risk, pacemaker, nerve block stimulators, and implantables. And even, I think in this case, like breast implants, those count as class 3 medical device because they're implantables. And so in this case, it's intended for the amputee subject population, which is an underserved population with many unmet healthcare needs. Oftentimes, they suffer from excruciating pain, be it from something called phantom limb pain, where, for example, they're missing their right foot, but they report having terrible pain in that area. And the other being stump limb pain, usually caused by something called neuroma, where the nerve that's been cut or severed due to the amputation, oftentimes the sciatic nerve in the leg turns into this disorganized growth of hypersensitive nerve cells and then often causing enormous amounts of pain. And so obviously this data is used for research to essentially block pain using high frequency signals, something we implant in the subject. So then the patient will then self-administer themselves these signals, high frequency signals as needed. And instead of opiates, which is really the only option they currently have, this could potentially be a life-saving alternative if all goes well. So for description, I have 10 to 20 different variables depending on the variables I do end up using. Uh, and so some of these variables include things like episodic versus persistent pain, above or below the knee amputation, baseline pain, is it is there pain relief, yes or no, their BMI, age, decrease in opiate usage, and etc. So in terms of the background, the process and approval of drugs, I think now more than ever has definitely impacted and will continue to impact many lives. And I mean, as I sit on this plane and think about, or I'll probably be thinking about all the travel restrictions that are lifted by simply being vaccinated, as well as all the other COVID tests that have to be put in place. So, anyways, even outside of vaccines, from drugs and medications to now, working on this medical device and talking to researchers on the statistical analysis for the process involved in this has led me to be more curious in not only what these statistics looks like in clinical studies, but more specifically, how can I gain a better understanding of the statistical approaches that surround these clinical trials? Well, that'll inevitably affect our lives and generations to come. So one place I was first pointed towards was the FDA guidelines, and the FDA is the organization that essentially um, all studies who look for approval for whatever novel drug or device, well, in the US at least, they have to go through. So seeing that the FDA actually has recommendations and guidelines made me wonder, even more, what do these guidelines look like? What are they recommending? And how are the people at work using this? So for the purposes of the study, I wanted to gain a better understanding about the role of statistics in relation to the FDA and overall clinical research, as well as how to choose an appropriate statistical method and the justifications behind it. And so this I hope to accomplish in reading through the literature and learning more about some of the best practices and even what's common knowledge. Then I'd like to apply these techniques myself on the data set from work, evaluate the results to better understand the underlying reasons and understand why I might choose one over the other. So in reading through the literature, I think I learned a lot, and honestly, I think there's still so much for me to learn and a rabbit hole of endless and useful, informative papers out there to be read. Um, but without going into it too deeply, the Cochran-Mantel-Hansel test is really simply put a way to test for conditional independence, meaning there's some kind of relationship between certain variables given prior information. And in going through the literature, other things of importance that I found included um, the understanding the associations of variables, what the confounding variables are, and as the FDA guidelines list, how and which covariates should we adjust for it to better optimize for the best estimate of the effect of the treatment. Um, Things like study design, balancing the degrees of freedom and power, which is basically just saying we're correctly rejecting the null hypothesis at a certain percent and essentially finding an effect that is actually there. And then tying that into the importance of sample size during the early stages um, before conducting a study and the calculations for a reasonable sample size and ensuring sufficient power. So, and then there's the domain knowledge that's needed and working with experts in um, understanding context over simply blindly using p-values is something that's greatly stressed in clinical research. And as for the statistical analysis plan, the unfortunate thing is since I'm blinded to the data, I won't know or I don't know at the moment who the treatment and control groups are. Therefore, I'm unable to know the true effect of the device in terms of pain reduction. But I can run a test to see if the pain relief subjects experienced based on survey data was significant or not. So by using the CMH, I'd use a proportion of response rates for the two groups alongside other covariates to check for conditional independence and see if any relationship might exist between um, variables that could be, explained by the use of the device. Then I'd fit a model using logistic regression um, between the subjects who experienced pain relief versus those that didn't, and select appropriate covariates there. Then perform some kind of diagnostics such as the calculating accuracy, sensitivity, specificity, the ROC curve, and use these for benchmarks in helping decide which model to use. So these are my references. And that is it. So thank you for listening in. And if you like the content, don't forget to smash the like button. And anyways, thank you guys. Have an awesome rest of your year and hope to see you guys soon.